Assalamualaikum warahmatullahi wabarakatuh. My name is Anissa Saleh, metric number 1710522, with the theme of future application of nanotechnology in disease diagnosis and treatment. I chose the topic Nanomedicine future application as treatment for endolymphatic hydrops in Ménière's disease patients. So, what is Ménière's disease? Ménière's disease is a rare disease that affects the inner part of the ear, in which there is an increase in hydraulic pressure within the inner ear endolymphatic system. Therefore, Ménière disease is also known as idiopathic endolymphatic hydrops. The term idiopathic is used as up to now the exact pathophysiology and cause is yet to be known. Ménière disease is best known for its symptoms, which include vertigo attacks, tinnitus, hearing loss, and a congested feeling in the ears. These symptoms are common among other diseases involving the ear and the brain. This is why a patient is only diagnosed with Ménière disease if all three symptoms are present. Currently, there are no treatments available that can cure this disease due to its unknown pathophysiology. Therefore, the treatments available for Ménière disease patients are only as management of the symptoms experienced by patients. The treatment can be divided into four categories: lifestyle changes, therapy, medication, and surgery. One of the lifestyle changes that can be implemented is salt restrictions in their daily diet, as it can help control the dizziness by reducing the water retention and lowering the fluid volume and pressure in the inner ear. For therapy, one of the therapy available for Ménière disease patients is the vestibular physical therapy, a therapy that is a specialized form of intervention based on exercise to manage the symptoms for Ménière disease. For medications, a common medication to be prescribed is an injection of antibiotic gentamicin into the middle ear. The last one is surgery. Surgery as treatment is an option that needs to be considered if the symptoms are too severe to the point that it endangers the patient, such as frequent vertigo attacks that leads to a car accident. So one of the surgical procedures available is labyrinthectomy, the removal of neuroepithelium on one side of the vestibular system. And this will prevent the symptoms from occurring ever again. As the site of the disease is located in the inner ear, a fragile part of the body system, the drug delivery using current technology is not efficient enough as most of the drug delivered did not reach the targeted area. The barriers that are needed to be overcome include the penetration of the blood-brain barrier or BLB. Therefore, the usage of nanoparticles is the best option as a drug delivery system. So the target in usage of nanoparticles is its usage for intracochlear drug delivery. The important aspect to be considered is the nanoparticles' biocompatibility with the cochlea and to ensure that it is not toxic for the inner ear system. So based on the studies done by other researchers, there are some nanoparticles that are suitable for intracochlear delivery as shown here. One example is magnetic nanoparticles as well as liposome nanoparticles. To date, there were some studies that have been done to assess the potential of nanoparticles usage for intracochlear drug delivery. So the first assessment was to determine the uptake or toxicity of the nanoparticles. A study was done to evaluate the risk of Josephson hydrogel-based nanoparticle on the inner ear, and the study was done using a mouse model. This study showed that the nanohydrogel possessed high potential in delivering the therapeutic drugs from the middle ear to the inner ear in a way that would not alter or harm the structure of the inner ear. The second one is on the attempt of drug delivery using nanoparticles. So a study was done in 2015 to investigate the sustained drug release properties and hearing protection effect of polyethylene glycol-coated polylactic acid, stealth nanoparticles loaded with dexamethasone. So it can be observed from the study that compared to the current application of drug delivery, the usage of nanoparticles as carrier for drug in the inner ear protects its structure for both anatomical and functional aspects. There are also several ethical issues that come with technology. For this, the ethical issue lies with the risks that come with the usage of nanoparticles to penetrate the fragile system in the inner ear. For the first risk is the size of nanoparticles. As the surface to volume ratio increases, there will be more chemical molecules on the surface. and this increases the risk of toxicity on the patient itself. The second one is on the shape of nanoparticles. A study has shown that between the usual shape of nanoparticles compared to nanotubes, nanotubes possess a higher risk of toxicity on the patient during drug delivery. The third one is the chemical composition and surface characteristics. As the nanoparticles can be made using different biomaterials, there will be different reaction of the materials on the different parts of the body. Therefore, there will be further modification done on the nanoparticles to ensure that there will be no harm done on the patient during the delivery. The last risk is on the nanoparticles as drug carrier. As the nanoparticles will be used as the carrier for the drug, it will be difficult to differentiate whether the toxicity comes from the drug or the carrier. That's all from me. Thank you.